Thank you. Assalamu alaikum. Good afternoon, ladies and gentlemen. My name is Suhail Assiri. I'm an orthopedic resident at National Guard Hospital, Riyadh. I'll be presenting our paper titled Back Pain and Scoliosis Prevalence in Adolescent in Riyadh, a cross-sectional study. In disclosure, we strongly assure that our team is absolutely neutral and made sure that there isn't any conflict of interest. In recent years, the research community took an increasing interest in adolescent health, with multiple studies addressing back pain and scoliosis. Identifying and addressing the possible public health hazard at early stages will help surely to mitigate their impact in adulthood. The Gelona study is the largest study done in Saudi Arabia exploring the health risk behaviors and the health status in adolescents in the kingdom, and they were recommending only for more high-quality public health studies to be done. A recent meta-analysis showed that around 40% of adolescents complained of back pain at some point in their life. Scoliosis, on the other hand, have a lower worldwide prevalence, around 5.2%, but unlike unspecified lower back pain, its complications are almost always detrimental if the patient left untreated with early onsets. Due to these limited data in the region, we aim to study the prevalence of back pain and scoliosis in Riyadh and Saudi Arabia among adolescents. Our design and setting, based on the student population per region, district, gender, and school level, proportionate sampling of each district was made to identify the sample size, which was around 700. We used a stratified cross-sectional study. A cluster sampling technique was conducted in randomized classes and schools using computer randomization. We include all male and female aged from 12 to 18. We excluded any patient with or participant with pre-existing back pathology related to the spine, any pre-existing general bone disease, any prior back surgeries or prior spine fractures, neurological and neuromuscular disorders as well. Our data collecting team received a standardized training by a spine surgeon and a board orthopedic certified surgeon regarding administration of self-administrated questionnaire. We distributed Oswestry self-filled back pain questionnaire and the Scoliosis Research Society questionnaire, and we did some anthropometric measurement as Adam forward bending test and the scoliometer measures. You can see the left side of the slide, you can see the pre-validated Oswestry questionnaire with interpretation of scores ranging from minimal disability to having almost crippled disability. It could be either that the patient is bed-bound or they are exaggerating their symptoms. This is the SRS questionnaire pre-validated into Arabic with a four domain of function, pain, self-image, mental health, and 2 questions for the satisfaction if the patient was having a positive Adam forward bending test or having a positive scoliometer measure. We set our confidence interval to be 95% with p-value significantly less 0.05. We gained our IRB approval, and our results showed out of 672 students, 592 met the inclusion criteria with 5:4 ratio female predominance. Our mean age was 15, and the family history of scoliosis found in 45 students, 41 of them in the first degree relatives. The Oswestry questionnaire disability was reported in 388 students, with 25 of them had 60% of disability. The SRS questionnaire, the student who filled the questionnaire scored 4 in all domain, with 3 in the main score. Positive back pain history was positive in 268 students. Adam forward bending test was positive in 174 students with positive correlation first degree family. Our mean age was around 6 degrees. This illustration showing the frequency of the 5-degree curve upon scoliometer measurement was around 17%. We did multivariate linear regression analysis, which show major correlation about major curve and the age and female gender with a p-value of 0.00. We found a higher incidence in female with having positive Adam test, around 138, and higher scoliosis prevalence among measurement of scoliometer device, around 135 participants. In conclusion, identifying the local prevalence rate with possible early associated factor at adolescent age have with no doubt major impact on our public health, not to mention the lower burden on the health system. We believe a nationwide study is required to identify the relationship between back pain and scoliosis. One of the limitations of our society is very conservative. That might raise a concern regarding missing information that could shine light into more evidence. Non-response bias is a concern. Whether non-respondent are more or less having varying chronic condition is unknown. Recall bias as well, as we are distributing a self-filled questionnaire. The burden of adolescent agony is largely preventable. Being a high-income country with abundance of resources, Saudi Arabia is at an advantage, and investing in the health of our young population will prevent further burden in the long run. This takes me to the end of my presentation. Thank you.